is always the rover. I am trained into your reach, feeling out the rock, gazing colourless, my eyes set apart as yours, tilt, twist. You are different to your sister. Soul by soul, I shrug each of you onto me, my frame flexed to your posture. Today, I can only move as she does. We are fragile. We take care not to fracture. It would be so easy for this to be the last time we could talk. Tomorrow, my shoulder will also hurt. My far-flung colleagues and I care for you both. We cannot speak eye to eye or touch you as once, years ago, we did. You have moved entirely into our minds. Our arms stretch only as far as yours, yet we hold hands. We talk for hours each day. We all are behind our eyes, turn around, image, go forward. All of us in this body together. My neighbour asks, when will we go to walk on Mars? She puzzles me. We wander there on 6 wheels every day.
Oh, thanks, Michelle. Michelle Bannister reading her poem, The Ensouling of Spacecraft. She is a lecturer at the School of Physical and Chemical Sciences at the University of Canterbury. It's coming up to midday, and at midday I believe there is a Checkpoint special hosted by Lisa Owen, who's with me now. Hi, Lisa.
Hello, Kim. Kei te whakarongo mai koe ki te reo irirangi o Aotearoa. Welcome to this 1 hour Checkpoint special on RNZ National. I'm Lisa Owen. E haere aki nei, if you are just joining us, we are preparing for the Prime Minister to address the nation. What we can tell you is there are 14 new cases of COVID-19 confirmed overnight, taking the total number of cases to 53. Another 1,500 tests were processed in the last 24 hours. One of the confirmed cases of 3 people are in hospital in a stable condition. The new cases are in Auckland, Waikato, Taranaki, Manawatu, Taupo, Wellington and Nelson. 2 of the cases, one in Auckland and one in Manawatu, have no direct links to travel.
RNZ News at midday. Good afternoon. I'm Anna Thomas.
And we are going to cut to the Prime Minister, who is waiting to address the nation from Parliament. So we know that there are 2 cases, one in Auckland and one in Manawatu, who have no direct links to travel at this stage. And health officials are telling us they cannot rule out community transmission in those cases. So those 2 cases require further investigation. One of them includes a person whose partner has a job that brings them into contact with people who travel overseas. The partner of that person is now being tested. In Manawatu, that case has no direct links. Here is the Prime Minister.
I'm speaking directly to all New Zealanders today to give you as much certainty and clarity as we can as we fight COVID-19. Over the past few weeks, the world has changed, and it has changed very quickly. In February, it would have seemed unimaginable to close New Zealand's borders to the world. And now it has been an obvious step as we fight COVID-19. This is because we are experiencing an unprecedented event, a global pandemic that in New Zealand we have moved to fight by going hard and going early. I understand that all of this rapid change creates anxiety and uncertainty, especially when it means changing how we live. That's why today I'm going to set out for you as clearly as possible what you can expect as we continue to fight the virus together. The first really important thing to remember is that the vast majority of people who will ever have COVID-19 will only experience mild to moderate symptoms. But there will be some who will need more care. That's why we have to focus on one simple goal: to slow down COVID-19. Slowing it down means not having one big tidal wave of cases, but instead smaller waves, groups of cases that we can manage properly as they arise. That means we reduce the impact on health, on jobs, and on our economy. Some countries and places have successfully managed to do this, but it does mean we have to be ready to step up our action when we need to. Here's how we will know what to do and when. Already in New Zealand, we have warning systems to try and get ahead of problems and hazards. We all know and recognise signs that tell us when we have fire risk or when to reduce our water use. Today, I'm announcing an alert system for COVID-19. That alert system can apply to the whole country, but sometimes it may only apply to certain towns or cities. There are 4 levels to the alert system. At each level, there are things we need you to do to keep you safe, and there are things the government will do too. Alert level 1 is where COVID-19 is here, but contained. In this phase, we prepare. The basics like border measures, contact tracing, and cancelling mass gatherings are all activated. You'll see that this is where we have been when COVID first arrived in New Zealand. Alert level 2 is where the disease is contained, but the risks are growing because we have more cases. This is when we move to reduce our contact with one another. We increase our border measures and we cancel events. This is also the level where we ask people to work differently if they can and cancel unnecessary travel. Alert level 3 is where the disease is increasingly difficult to contain. This is where we restrict our contact by stepping things up again. We close public venues and ask non-essential businesses to close. And alert level 4. This is where we have sustained transmission. This is where we eliminate contact with each other altogether. We keep essential services going, but we ask everyone to stay at home until COVID-19 is back under control. It's important to note that with every level, supermarkets and essential services like access to pharmaceuticals will continue. Shop normally. If we do that, our supermarkets will have time to restock their shelves. We will use this alert system every time we update our cases, so you'll know if the status in your area has gone up or down or stayed the same, and what you'll need to do. Today, I am confirming that New Zealand is currently at alert level 2. That means the risk of community transmission is growing. And so to stay ahead and reduce the chances of the wave growing, we need to step things up. Now, we already have many of the measures for level 2 in place, but there are some that are new. Here are the things that we need from you. Today, we are asking people over 70 years of age, or people who have compromised immunity or underlying respiratory conditions, to stay at home as much as they can. That means we need friends, family, and neighbours to support our older New Zealanders and people who may be in this group by doing simple things like keeping in contact and dropping off food or other supplies. When you do, make sure you are not sick, that you are using good hand washing practices and you're keeping your distance. We also need everyone to start working differently. Many offices have plans for workers to work from home. Others have staggered meal breaks or shift-based working. We are now asking you to implement these plans. Now, we know not everyone can do this. We need and will continue to have health and emergency professionals, transport and delivery staff, supermarket and food production workers, and other essential people continuing on at their place of work. And there are some sectors where work from home is impossible. There are still steps these workplaces should take at the same time, like additional cleaning and physical distancing as much as possible. And finally, we are asking that you limit your movement around the country. This will help us track and contain any spread of COVID-19. That means cutting non-essential domestic travel. Every unnecessary movement gives COVID-19 a chance to spread. Now, for those of you who are parents or caregivers, You will have questions about schools and education facilities. At Alert Level 2, schools will be closed if there is a case that affects a school, as we have been doing to date. That may change if we move into higher alert levels. But sending children home at this stage doesn't necessarily reduce transmission in the community. But I can assure you, we are constantly monitoring these settings to keep schools and children safe. As a mum, I can assure you this is my key consideration. Finally, this is a time when I know people will want as much information as possible. It's also a time when there is plenty of misinformation. All of the advice from the government about COVID-19 and how it affects you is available at covid19.govt.nz, including more detailed guidance on this announcement. Till then, I know this current situation is causing huge disruption and uncertainty, and right now I cannot tell you when that will end. This alert system is designed to help us through that, so please do stay tuned and we will share daily updates, especially as alert levels can move from one level to the next in a short space of time, as we have seen elsewhere in the world. For now, I ask that New Zealand does what we do so well. We are a country that is creative, practical, and community-minded. We may not have experienced anything like this in our lifetimes, but we know how to rally, and we know how to look after one another. And right now, what could be more important than that? So thank you for all that you're about to do. Please be strong, be kind, and unite against COVID-19.
That is Prime Minister Jacinda Ardern addressing the nation. It is 10 minutes after midday. This is Checkpoint on RNZ National, and we will be with you for the next hour. Joining me now is Susie Wiles, microbiologist, and Rowan Quinn, RNZ's health correspondent. If I can start with you first, Susie. This alert level 2 and the request for certain people to stay, well, as at home as much as they can. Can you explain the thinking behind that?
Yes, so I'm absolutely delighted to hear about the alert levels coming in. This is exactly what New Zealand needs because so many people are concerned and they don't know what the right thing is to do. You know, we've been asking people to wash their hands and to limit their contact with others. This now gives us a really clear idea of what to do at different stages. So at alert level 2, what we're asking is that those people who don't need to be, in contact with other people, if you can work from home, all of those kinds of things, that we start doing those actions. So we shouldn't be going out to bars, and restaurants with our friends. We should be sticking with our household units and limiting basically contact with others.
So in that group of people, she listed the Prime Minister over 70s, those with compromised immunity, and anyone with underlying respiratory problems to stay at home. We're talking about a big chunk of people, aren't we?
We are, and the thing is that we need to protect those people. So we want those who are vulnerable to be limiting their contact with others as much as possible, outside of their household. And then we need everybody else who is able to limit their contact to do that. Because we have to think of ourselves as little links in a chain, and think of that chain as being a chain that COVID-19 can pass through. And so every one of us that limits our interactions with other people is a chance where we can break one of these transmission chains, and we could stop lots of other people contracting this virus.
If you're just joining us, the Prime Minister has just addressed the nation there and, unveiled a new alert system directly related to COVID-19 with 4 levels. In the studio with me is Rowan Quinn, our health correspondent. This is interesting, isn't it, Rowan? It's very, I suppose, a clear path that people can follow, 4 alert levels.
Yeah, and I think because we have seen people being a little bit confused about what they're supposed to do with self-isolation, what they should be doing themselves now, and this sort of is setting out a very clear path of alert level 1 through to 4, and the Prime Minister saying we're at alert level 2 now, where we have the disease contained but the risk is still growing, and so that is all those measures are about restricting contact and increasing some of those restrictions that we have in our daily lives.
So she was saying if you're at work, try to stagger meal breaks, stagger shift starts. She's saying that deliveries and those essential services will still take place at all 4 alert levels, including you'll still be able to go to the supermarket, so don't panic. You'll still be able to go to the pharmacy and the chemist.
That's right. She's been very clear that those things will be available no matter what. But at the moment, the idea is if you can work from home, you do. And that if you do have to come into work, at this stage, she's saying, acknowledging there are places that it's difficult to work from home, you try and keep that gap between your colleagues, as you said, to have the lunch breaks maybe at different times. But if you can, try and work from home. And of course, also, it's about protecting those people over 70 and the people with immunocompromised conditions or respiratory conditions, and asking them to really pull back and stay home where they can.
Susie, can you explain this in the context then, with schools still open? Why is that? Because people keep asking that question.
So we do know from all the data so far that children, while they may transmit the virus, they are not going to be badly affected. And the problem with shutting down schools right now is that actually it ends up, lots of families can't deal with that. Children might end up going to grandparents who we know are the vulnerable people. So that's why, if the family itself limits contact with with outside people outside the household, even if children are carrying the virus and come home, we can limit the movement from that household to other household, if that makes sense, because the rest of us are limiting our movement. So this is really important, and I think it's worth saying because lots of other countries are actually at level 4. They went straight from 1 to 4 because they acted too late, and we're trying to do this. We're following the countries that have contained this really well, who have had this alert system, and the thing is that you can move backwards and forwards between different states depending on how well things manage to contain and everybody listens to the advice and what we're asking. But also it can be different in different regions. So we might have some that are at a level 2, and then maybe we'll see a case and that will move a place to level 3, and then as it's contained it will move back down to level 2. So we just need to be, we'll be told where we're at, and then we need to listen to what those things are, because I hear a lot of people are still behaving as though this is just something that's not really going to happen to us. And we know that it's happening in other countries, but we also are following the countries that are keeping it contained and stopping the impact of this being really, really bad on the health system.
Susie, we are getting questions in from listeners and viewers, and I'm just going to put this one to you. This person says, I am 73 years old. I'm in good health with no other risk factors. Can I go out for a walk at a distance from other people?
Absolutely. So this is the same as the stay-at-home self-isolation rules, where you can go out and do things. You can go for a walk. What you need to be doing is limiting your contact with other people outside of your household to less than 15 minutes from a distance of 1 to 2 meters. So you can absolutely go for a walk. And you could even go for a walk with friends, providing you stay that distance apart. So it's just about that close contact. We're just asking people who are in that vulnerable age, because you may feel really healthy, but you are in the age where, there have been higher deaths.
Rowan, this was, I don't remember a time when we've had a Prime Minister basically looking straight down the barrel of the camera, addressing the nation on radio, telling us all to, in essence, keep calm and carry on. In fact, her words were, be strong, be kind, and unite at the end of that discussion.
Yeah, I mean, it's something we normally see from America is what I'm thinking of, the president there looking down the barrel of the camera. And I guess it's maybe to reinforce the seriousness of this situation. But she's also talking she's trying to assure us as well that, we can keep calm and carry on. But it's unusual. And I guess it's trying to get a bit of gravitas to this situation and to really try and impress upon New Zealanders. Maybe as Susie was saying there, some people aren't taking this seriously. They are still going about their lives exactly as they had before. And she said there also as she opened her address, that the world has changed and things that are happening here would have been unimaginable a few weeks ago, like the massive border restrictions and some border closures. So I guess perhaps that change in approach from her is reflecting the fact that this is unprecedented in New Zealand.
Susie, it's a balance, isn't it, between getting the information to people and asking them to take it seriously and not scaring them? Because she was saying, the Prime Minister saying, the vast majority of cases, remember, will only experience mild to moderate symptoms. But where is that balance to get that information across, but to have people still take it seriously and not scare them?
Yeah, well, and the other problem with most of us having a mild to moderate illness is that we can still transmit it to others unknowingly who will not have a mild to moderate illness. And I think that's why we have to change our mindset about this being about us and how this is going to impact us, and thinking about if we had this and gave it to someone else, how would it impact them? So really, I mean, I have people saying, well, I was going to a barbecue today. Well, no, you're not going to a barbecue today, because we're asking you not to be in close contact with people outside of your household. Because if we can contain things to households, that allows us to limit the spread so much more.
Really appreciate you joining us. That is Susie Wiles, microbiologist. If you are just joining us, the Prime Minister a short time ago addressed the nation and revealed that we are having a system, a 4-alert system. Now, those 4 alerts, well, we are currently at level 2, I should tell you. Level 2 is where we are at. The first level is where COVID-19 is here but contained and the risk is low. It involves border measures, contact tracing, and it has been in place since the coronavirus was first detected in New Zealand. We are now at level 2, which is where the illness is contained, but the risk is growing. There are more border measures in place, and people need to distance themselves and isolate where possible. At this level, schools will close if there is a confirmed case, but closing all schools at this stage doesn't necessarily limit the spread of the illness. The next level is level 3, which is where things step up again. Non-essential businesses will close, cafes and bars shut down, and this is really limiting contacts with others. Lastly, there is level 4, which is where contact is eliminated between people altogether, and everyone apart from essential services is asked to stay at home until COVID-19 is under control. The Prime Minister today asked people who are over the age of 70, those with compromised immune systems, she asked them to stay at home as much as they can and for people to limit their movement around the country as much as possible. Her message is to be kind and unite in the fight against COVID-19. In the studio with me is RNZ's health correspondent Rowan Quinn. Look, this was obviously a lot about giving people certainty about what to expect too, isn't it, Rowan?
Yeah, and I think also perhaps a reflection of the changing situation here, and people who have been following this closely would see that the number of cases we've had in New Zealand have gone up quite quickly over the last few days. We had 8 on Thursday, 11 more cases yesterday, 14 more cases today. So it's still at the stage where they're saying that the disease is contained, but we had Ashley Bloomfield, the Director General of Health, saying that there is a risk that there has been community transmission in a couple of cases. And
tell us about what that means and why they're suspicious of these 2 cases.
Well, community transmission is where the disease is transmitted when there's no obvious link to someone who's already had the disease, or in the case of New Zealand, someone who's come from overseas, because all of our cases so far have had a really strong link to someone who's brought the disease in from overseas or has brought the disease in from overseas. So Ashley Bloomfield was saying this morning that there are 2 cases that they haven't got to the bottom of yet. So that's why they're saying there is a risk that they could have caught this disease from somewhere in the community. We don't know where. And of course, that's then a worry, because if you're trying to stamp out the disease, how do you track it? How do you find the source of the disease to then stamp out the other people that have been in contact with that person? So they're not saying that there's definite community transmission yet. What they're saying is there are 2 cases, one in Auckland and one in the Wairarapa. The one in Auckland is someone whose partner has a lot of links to overseas people, and so they're investigating the fact that there could be an overseas link there. The one in Wairarapa, a few more questions over that. And also Ashley Bloomfield is saying they're not sure whether the person caught the disease in the Wairarapa or may have caught it somewhere else and brought it back.
Thanks, Rowan. Well, joining us now is the CEO of the Employers and Manufacturers Association, Brett O'Reilly. Brett, how should businesses adjust to doing the right thing here?
Sure, Lisa. I think businesses have already been preparing this week, and we've had a lot of contact with our members who I guess have anticipated that this might be coming. We've published our guide to working from home on our website, www.ema.co.nz. That's free for any businesses that just need a guide to best practice around that. I know in our own case, we sent a note to staff earlier this week saying if you're over 70 or you had an existing condition not to come to work, and some staff have already opted to do that. So I think businesses largely well prepared, and I think obviously we thank the government for being proactive in this way and keeping people across what's going on.
She's also asking, the Prime Minister is asking for people to keep domestic travel to an absolute minimum. What impact is that going to have on business?
I think from the feedback I've had from businesses, they'd already started to put a lot of this in place this week. We've certainly seen a number of meetings and events cancelled. We had a Business New Zealand Major Companies Group meeting yesterday, actually, which had the Finance Minister and the Reserve Bank Governor speaking to that group, and that was all done via webinar. So I think businesses have largely been anticipating this, but look, if they've got any questions, our advice line team will be back online on Monday on 0800 300 362, and there are obviously other business organisations that are providing advice as well. So there's plenty of places to go to get advice on best practice.
So in your business, where you employ a few people, I mean, how are you dealing with this already? Are you moving desks apart? What are the practicalities of all of this?
So we have 90 staff and about another 50 contractors that work with us. So we run training courses. So we've been making sure that where people still want to come to the courses, and actually they have been, that we've been practicing good separation, that there's been hand sanitisers, that we've been encouraging personal hygiene. As I mentioned earlier, anybody who has been concerned about coming to work, we've allowed them to work from home. We've had a couple of staff members who have elderly parents or grandparents that they look after or felt that they needed to be looking after. So we've tried to be as flexible as possible. We've trialled our capability to have everybody working from home, and worked with our telecommunications and technology suppliers to make sure that capacity exists and that we actually trial it, and that's been successful. So I think they are all of the precautions that we have done based on best practice, and from the calls that our advice line have been getting. We've been getting about 300 calls a day all week, plus many emails and other...
What are the common questions that they're asking you? When you say you're getting about 300 calls, what do they want to know specifically?
Obviously, a lot of interest in the government's business continuity package, and the further announcements yesterday from the Reserve Bank that they're giving banks a lot more flexibility in dealing with businesses was welcomed. So a lot of questions about that. A lot of questions about how to deal with leave, some of which were addressed by the government's announcement on Tuesday that you and I worked together on Checkpoint, but also a lot of other questions around what happens if staff are away for a prolonged period of time. Just how do they manage that? So we're working through those requests. We had a bit of a win yesterday where one of the functions that we perform at the EMA is we look after the Cosmetics Industry Association. Garth Wiley, who is one of our staff members who does that, raised the fact that hand sanitizer could only be produced in 10-litre batches. So we've managed to talk to WorkSafe and the government, and they've announced that hand sanitizer can be produced in lots of 1,000 litres, which is great. Apparently that was once the case some years ago. So those sort of practical things are all helping. I think the other questions that businesses are just really having is, just to give them advice around restructuring. These are such different and uncertain times, and obviously, regrettably, some businesses are going to have to think about that, particularly if they're going to be closed for any length of time. So while the government's business continuity measures have helped, there is still concern out there.
On that subject, Brett, obviously we're at level 2. There are 4 levels, and at level 4, we're talking about everything but essential services shutting down. I mean, some businesses, and obviously the businesses that you represent, they simply cannot do their work from home. What are the implications of us getting to level 4?
Look, I think if we get to level 4, we will regrettably have some businesses that will struggle to survive. And we're already hearing that message from them now. We're doing everything we can, working with the government agencies. We're having daily calls with the Ministry of Social Development and with MB, and providing them with feedback. And they're listening, and they're obviously looking to try and minimise the chances that businesses won't survive. But for some small businesses, these are very, very tough times. We're obviously also thinking about what kind of requirements businesses might have for retraining. That's a little bit further down the track. But obviously, it is very uncertain. And when I've talked to some of the businesses, or I've been down in the advice line listening to some of the calls that are coming in, you can tell that there's a really heightened state of anxiety, and who can blame people? These are really, really difficult times.
Brett, just before you go, do you think actually having a roadmap here, these 4 alert levels, will in some way allay some of the fears of businesses? They can see where it's headed and what to expect.
Yes, I think it's a really good move by the government. I think we saw a bit of panic and hysteria over the last couple of days when rumours went round about, a lockdown was about to be announced for the whole economy. And obviously with social media, those stories can get around quite quickly. So I think this gives everybody a clear sense of where we're at, a clear sense of the actions that they should take at each point. So I welcome it, and I think it along with many of the other initiatives that we're all trying to take, is the best chance that businesses will survive, be able to survive through this disruption, and that people can try and still function without being too fearful. I think it's a lot of what we're picking up is people are just so fearful because obviously they're seeing what's happening internationally about what to do. So I think this gives people a very clear picture about what they should and shouldn't be doing in their daily lives, and I think that's really important.
Appreciate you joining us. That's Brett O'Reilly, who's from the Employers and Manufacturers Association. It's 12:29. We're expecting the Prime Minister to start a press conference very shortly. We will take that live as soon as it happens. But just to update you, there will be an alert system that is coming into place immediately. There are 4 alert levels. We are currently at level 2. The first level is where COVID-19 is here but contained and the risk is low. That involves border measures, contact tracing, and it's been in place since coronavirus was first detected in New Zealand. We are now at level 2, which is where the illness is contained, but the risk is growing. There are more border measures in place. People need to distance themselves and isolate where possible. At this level, schools will close if there is a confirmed case, but closing all schools at this stage doesn't necessarily limit the spread of the illness. The next level is level 3, which is where things step up. Non-essential businesses close, cafes and bars shut, and we're really limiting contact with others at that level. The final level is level 4, which is where contact is eliminated between people altogether. And everyone apart from essential services will be asked to stay home until COVID-19 is under control. We will take the Prime Minister's press conference live, after which we'll be joined by Professor Michael Baker. We know you have a lot of questions, so you can send them through. Text us on 2101. You can email us at checkpoint@rnz.co.nz, and we will try to answer as many of those as possible. But in the meantime, we are standing by for the Prime Minister's press conference. In the studio with me is RNZ's health correspondent Rowan Quinn. Rowan, in particular, there are 2 cases. We are going actually now to the Prime Minister's press conference live.
Thank you for joining us. We're happy to take questions based on what you will have heard me announce at midday. What I want to first set out is that the framework from which the announcement was based is available at covid19.govt.nz. People can clearly see the alert system and the different expectations of the public and also the government at different points in that alert system. What I want to acknowledge is that obviously there is great interest in the system and the information provided today. So there is increased demand on the website currently. I do just want to let people know this will be available on social media, a range of different outlets, and will continue to be available throughout the course of the day and obviously the coming weeks. I also just want to anticipate what will be, I expect, a number of questions as to the practical impact for different workers, different workforces. Those questions obviously best directed at your employer in the first instance. For those who have direct health needs, please do look first at the website to see extra information about how it may affect you. Leave Healthline for those more immediate needs. This is one way that we can make sure that those who need assistance and support directly are able to get through. I say that having no information on demand on those lines, but certainly just anticipating based on what we've seen to date from new information in the community. For now, though, I'm very happy to take questions, as is the Director General of Health.
When you went to Rotorua this week, businesses were talking about needing to rely now on domestic tourism. You're effectively cutting that off. Are you expecting that you'll need to ramp up the business continuity package exponentially?
When I visited Rotorua, one of the clear messages from businesses was also go hard, go early. That will also help protect our businesses in the long run, and that's what we've done.
What are some of the risks to old people, I suppose, because they're now going to be people over 70 moving into effective isolation?
What we're saying to those who are over 70 years of age or have issues with immunity or some other underlying health conditions, that we are asking them to stay at home as much as they can. This is a simple measure that we can take to make sure that we limit the chances of their exposure to COVID-19. In turn, that keeps them safer and limits the resource that we might be needing from our hospital system.
What instances should people not travel domestically, and in what cases do you think they can?
We're asking people to be very practical here. In this level of alert, we ask people to reduce their contact with others. So really just ask yourself that simple question, is this essential travel? Reduce that contact. If you do need to travel, keeping your physical distance at all times.
How quickly can we move to alert level 3?
Daily updates will be provided at the time the Director General sets out the cases for that day. He will also indicate any movement in our alert system. That could apply to local areas or it could apply nationally. You could move both up and down, and that could happen at a daily notice.
What are the implications to alert level 3?
As you will have seen as we set out, restrictions at level 3 are through heightened risk that the disease is not contained.
What are the implications
not at that point yet.
What are the
Sorry, I'll come to Jessica.
What are the implications for domestic travel for Air New Zealand with this announcement?
Air New Zealand have already anticipated some of these requirements. So what they're doing with their seating arrangements is to build physical distancing into their ticketing and seating.
And how closely will it be monitored? You know, effectively asking people don't travel if you don't need to. Will there be anything like road checks, or are we
are asking people to take responsibility for their own decision making here. If we move further up alert systems, then that will change. But right now at alert level 2, we ask people to take responsibility for their decisions and make their own judgments. But please keep in mind, the more contact you have with others, the greater the risk.
It's wider up in Auckland on the verge of moving into that next level.
As we've said with this framework, you can have regions move up the alert level. The criteria we've given is if community transmission is occurring or there are multiple clusters breaking out. So we make those assessments as we have that information coming through. At this stage, though, all of New Zealand is at level 2.
Prime Minister,
I'll come to the front. There's good time for everyone.
are you working on the assumption that there is some degree of community transmission at this point?
As you will have heard the Director General state this morning, we cannot rule that out. Obviously, Public Health have undertaken their investigations with those who have tested positive, but they are still investigating some of their wider contacts. So we're letting them do that job. Right now, all of New Zealand is at level 2, but as you've heard me say, we do need to be prepared that regions or the country could move to level 3.
We see a shift to level 3 in the case of just one instance of community transmission?
I'll let the Director General answer that question.
What we need to do is look at, of course, not just any evidence of community transmission, but also what's happening around the country and where it's happening. And if, for example, we have a person who has done a lot of travel around the country and we can't identify exactly where that community transmission occurred, then we may look at the whole country. But generally speaking, we would be looking first of all just at that local community.
I think what we need to remind people is that in everything we've done so far, we've been willing to move on risk. We've been willing to move early to preempt potential growth in cases and waves, and we will continue to do that as we apply this alert system.
You talked about schools. You talked about schools there and saying, look, kids will still be going back to school. Yeah. You have consistently said we're trying to move ahead of that at the moment. So that's still the decision kids carry on.
And there's some very specific criteria that has been developed by the Ministry of Education to give people a very clear idea of when that will change for their school in their area. And so in alert level 2, if there is a case attached to a school, the school will close. There'll be contact tracing, 72 hours of thorough cleaning, and then the school will reopen. If we have wider community outbreak, that guidance may change, but I want to assure people, my number one concern, of course, is the school, the people who work within it, but the children as well. Breaking schools up now may not, however, reduce community transmission.
And that's the Prime Minister Jacinda Ardern giving a press conference after her address to the nation about COVID-19. We are not doing enough. All our measures are too conservative. We are still behind the virus, not in front of it. That's the view of Public Health Professor Michael Baker of Otago University, and he joins me now. Good morning. What do you think of the measures that the Prime Minister has specifically brought in today, this 4-level alert system?
Well, firstly, I think I really want to congratulate the government on fantastic leadership on this problem, and I think there's huge willingness to act, and we've seen that decisive action with closing the borders, largely closing the borders, and a number of other measures. But unfortunately, we're still underestimating this virus, this pandemic, as every country on earth has done, except with the exception, I think, of some countries in Asia that have been through SARS, they know what's involved. None of us have experienced this before, and I can understand that politicians are reluctant to do very disruptive things. Our public servants, again, are trying to be, balanced, and the word proportionate keeps coming up. But we're against a threat here that we've never encountered before, and unless we get ahead of it, I think we will lose the battle. I don't like wartime metaphors, but we are in this battle, and I think now is the time for absolutely maximal measures. So I would be saying it's level 3. Possibly level 4 is what we need to do at the moment. And
so what, regional lockdowns? Would that be what you would be advocating for at this stage?
Well, given the distribution of the virus affecting a number of parts of New Zealand, I'm not sure if regional is proportionate anymore. I think we maybe need to look at going beyond that. That might be an option, but I think we're being far too conservative in how we've responded to this.
So specifically, what would you do right now? Tell me what you would allow citizens to do and what would be shut down.
Well, I think we talk about maximal social distancing, or physical distancing is I think a better term, which is coming in. So it means looking at the places where virus transmission occurs. We know that about a third of it happens in workplaces and schools, so they have to be, as fast as practically possible, shut down, and public transport associated with them. And
so shut down schools as soon as it's possible to move kids offline or to other means of teaching. Shut them down totally across the country.
I would say so. And I think one way is to bring forward the school holidays. It may not be possible to do it. None of this is immediate. You do it as fast as practically possible. And it's best to do things in a slightly planned, systematic way. But don't leave it much longer. So that's schools, workplaces. The other place where a third of transmission happens is in social venues. It's not even so much the big gatherings. It's just all those situations where you get together with friends and you know them well, so you get quite close to them, which is just a human reaction. So unfortunately, all those settings need to be shut down as soon as possible. A third of transmission happens in the home, so obviously that's not an environment we have much control over. But I think the advice about identifying vulnerable people is so critical, because this disease risk is really concentrated in the elderly and those with underlying conditions.
People are getting in contact with questions for you. I'm wondering if you can help with some answers with some of these. This person says, should I stay home from work if I have an underlying condition of asthma?
Well, it depends on the severity of it. If you're maybe having steroid or immune suppressive treatment, then yes, you are more vulnerable. But again, that's something that people should have that conversation with their doctors about.
Another person says, I'm in a multi-generational house. Should my kids stay home to protect their grandparents?
Yeah, I think that's one of the reasons, because unfortunately, children have very mild symptoms and they do very well with this infection. But unfortunately, because they seem quite well, they can easily get infected and then bring the infection home. And that's the experience overseas. Then older people in the house are more vulnerable.
So what do you do then? Do you have the grandparents on one floor, or you stick them down one end of the house and you try and keep the kids and the grandparents apart?
Well, I think the thing is that that's why the kids shouldn't be at school now, because that's where they're going to pick up the infection. So you are thinking of, for most people, the household unit is something that you want to keep together, of course, and but you want to think about the situations where transmission is going to occur, and it's anywhere where people go, because it's not enough just to walk around with your hand sanitizer, and a lot of surfaces will be contaminated in public areas, and people will be coughing on you occasionally. So it's just thinking. I mean, it doesn't come out of the air; it comes from other people. So you've got to think about that source of transmission.
That seems to address a number of questions here. I'm just going to barrel through them all in one go. So we've got another one which says, I have a couple of close friends coming over to our family home for dinner tonight. We're in our 40s with 2 kids. Should we still have our friends coming over? And another person is saying that, are we supposed to minimise all contact with other people and essentially stay at home?
Yeah, I think at the moment, I think it's a balance. And look, having friends over is really important, and I think we wouldn't want that to stop. I mean, that's just part of our lifestyle and our social support at this stage. But I think it would just be doing things a little bit differently in terms of obviously how you greet people, and hopefully people are paying a lot more attention to hand washing. And if anyone is even slightly unwell, don't go, because that's still the most important single measure. If you're an adult and you have this infection, you almost certainly will have symptoms. People may be symptomatic for a day or two before, or infectious for a day or two before they get symptoms. So that's still an area of vulnerability. But I think if you feel in any way unwell, just don't go and do anything social at the moment with other people.
So this one relates to immunity and also children. They say they are in a high-risk group with a rare blood disorder. They've got 3 kids up to the age of 17. They are trying to isolate themselves as much as possible, the person with the blood disorder. The question is, should the 3 kids be allowed to go out and socialise as they do normally and come back to the house as normal with the person with the blood disorder?
Yeah, I think it's basically you have to think of the lines of transmission. Kids going out and socialising, the thing we love about them is they do invade your social space and they do get close and physical with their friends. So that is how the virus will move around. And kids often have very few symptoms. So they are, in most viral infections, kids are one of the major ways they get transmitted. I think the role of children is still not totally clear with this infection.
So does the alert level system today, this person is asking, mean that really you should abandon any plans for domestic travel over the school holidays?
Yeah, I think so, yes. But look, I don't have the answers to all of this. This problem of community transmission, this is a new, very significant development. Because if you look internationally, every country except a small group of countries in in Asia are now on an exponential curve. And New Zealand was the last country on earth, as far as I can tell, that was not on this curve. And I think we've maybe been a bit complacent. We're now on that curve, and I think we have to get off it as fast as possible. Otherwise, we know the scenario, we see the scenario on our televisions every night. It's very hard to stop that exponential rise once you're on it.
Do you think that we have community transmission right now? Do you think we actually already have it and just don't really know that?
I think it's highly likely.
And what makes you say that?
Well, I think the growing number of cases, their geographic spread, and the fact that many young people who come back from overseas or are in the community will have very minor symptoms. Some may have no symptoms at all, and that's the difficulty. So they won't have been tested. And New Zealand has ramped up testing, which I think is very reassuring, but we still have to do a lot more of it. So what myself and some of my colleagues are advocating for is a major pulse, we call it a pulse of intense social distancing or physical distancing for a few weeks until we've done a lot more testing and we really have a better handle on the level of infection in the community.
So when you say social distancing and a period of testing, would you go so far as to lock down the country for 2 weeks and do that increased testing during the time when you are absolutely limiting people's freedom of movement?
Yeah, I think, I don't like that term particularly, but I think that's the idea of it. And I think you're obviously trying to minimise disruption to the community, but unfortunately, the alternative is you wind up, unfortunately, in a situation of countries overseas where they're facing lockdown for months because they didn't get ahead of the curve. So I think we've got that opportunity to do that now.
So what about other forms of public transport, not the airline? You know, I'm talking about getting the train to work and the bus.
Yeah, I think they are something that will go, unfortunately. I mean, I'm a huge fan of public transport, but it is an environment that's very hard to manage risk there. I mean, the Chinese did start managing. So
should they be gone now, Professor Baker? Should they have already shut down trains and buses at this stage?
I think, I think all of these activities should be shut down now. That would be my view, given the situation. And that means basically going up the alert scale at least one level.
Is it realistic to have a situation where you just have parts of the country ring-fenced? I know you don't like the phrase in lockdown, so, you know, this whole concept of shelter at home, as the Americans call it. Is it realistic to have separate communities around the country doing that while others are roaming more freely?
I think it is realistic. I think it can be done. The problem at the moment is we don't have enough testing data around New Zealand for to know what the level is in each community. To say we haven't got much data from, say, I'm just going to use the Wairarapa, for example. So we have to just assume that they don't have transmission there. That's the difficulty. If we were doing thousands of tests a day across the whole country, I think we have a lot more a more granular view of what's actually happening.
So yesterday there was 1,500 tests done across the country. When you say we should be doing thousands, what do you think would be a realistic daily rate of testing that would give us a better picture?
Well, I think it's partly that we've only got up to this point now. I think if we had a great pulse of intense social distancing for a few weeks to give us time to have done thousands of tests around the country, which is happening now, I think we'd get to a point where we have a much better picture of the level of transmission in New Zealand. Because, of course, New Zealand has shut down the borders very effectively. I think we're doing all the right things. But my view is we've just consistently underestimated the intensity of this infection, as every other country in the world has. And the thing that really worried me last week was the fact that Australia has lost containment quite dramatically, and we're now seeing it's very much on this exponential curve. And Australians are somewhat like us in how they behave. Both countries are in, late summer, early autumn, and the Australians have lost control. So where they go, we often follow, and I think we're on that path now.
Have you made your views clear to the government about this potential 2 weeks where we restrict movement heavily and what you call a pulse of testing, and how have they reacted to that if you've had the conversation?
Well, we, with a colleague, Professor Nick Wilson, we put out a piece on Thursday last week, this week we just had, and that went very widely to decision makers advocating this strategy. And so it is being actively discussed. We're a small country, and I think a small society, and I think that people are having a very active dialogue about this.
Really appreciate your time. Thank you for joining us. That is Public Health Professor Michael Baker of Otago University. Now, if you're just tuning in, the Prime Minister has addressed the nation to provide details of a new alert system for responding to COVID-19. There are 4 alert levels. We are currently at level 2. The first level is where COVID-19 is here but contained and the risk is low. It involves border measures, contact tracing, and it's been in place since coronavirus was first detected in New Zealand. We are now at level 2, which is where the illness is contained but the risk is growing. At this level, there are more border measures in place. People need to distance themselves and work differently and cancel unnecessary travel. At level 2, schools will only close if there is a confirmed case, but closing all schools at this stage doesn't necessarily limit the spread of the illness. The next level is level 3, which is where things really step up again as the illness is becoming harder to contain. Non-essential businesses will close, that's cafes and bars will shut up shop, and we will really limit contact with others. Finally, we get to level 4, which is where contact is eliminated between people altogether, and everyone apart from essential services is asked to stay at home until COVID-19 is under control. In all those circumstances, pharmacies and supermarkets will remain open. They will remain open at all these levels. And the Prime Minister is stressing that people need to continue to shop normally and not to panic. Jacinda Ardern today also asked people over 70 or those with compromised immune systems to stay home as much as they can and for people to limit movement around the country as much as possible. Her message is to be kind and unite in the fight against COVID-19. Earlier today, the Director General of Health, Dr. Ashley Bloomfield, announced there were 14 new cases of COVID-19 in New Zealand, and the Ministry cannot rule out the risk that there was community transmission in 2 of those cases. The new cases bring the total to 53 confirmed cases of COVID-19 and 4 probable. The locations of the new cases are in Wellington, Taranaki, Auckland, Waikato, Taupo and Manawatu, and there are 2 in Nelson as well. 3 of New Zealand's confirmed cases are in hospital and they are in a stable condition. I'm joined now by our political editor, Jane Patterson. Good morning, Jane. Good afternoon, rather.
Good
Jane,
afternoon, Lisa.
This was somewhat extraordinary, seeing the Prime Minister address the nation in the fashion that she did, wasn't it?
Certainly the way she delivered this message really underlined the significance of what she was saying and that direct appeal to New Zealanders. She wanted to be talking directly to the community, which is why she chose this method of delivery. And of course, announcing that alert system, which I do think gives some certainty and some clarity to people, because all of the questions that we're hearing are, what should I do? How long is this going to last? What does it mean for me, my family and my community? So at least this gives people a sense of where we're at, what the options are, and also just the potential implications if we do go into that 3rd or 4th level, actually what that would mean for people. I think that will really help public confidence, having a little bit more specific information like that. And of course some very important messages from the Prime Minister as well. Regardless of those alerts, supermarkets and pharmacies will remain open. A real plea not to panic buy, that supermarkets can restock and that people who might not have the resources to stock up will still have access to essential goods. Take your information from official sources. There's a huge amount of rumours and weird and stories going around. She's saying, please listen. There are several areas online, government sources that you can listen to or go and check out online, and of course the daily updates as well. And also the measures today announced, of course, really aimed at limiting infection to those vulnerable, but also like with domestic travel, so that they can track people down, so it makes contact tracing more easier to do. If people are found to have tested positive and they've been out and about around the country, it makes it much more difficult.
So at level 2, this is a request. It's a request from our Prime Minister for those vulnerable people to stay home, people over the age of 70. As we get further up that scale, it no longer is a request, is it, Jane? It's basically a command.
That's right, and we saw this at the border. So in the first announcement last Saturday, only a week ago, the Prime Minister basically said, people would be expected to self-isolate. Obviously, there was a sense of obligation, but then that really hardened up into a hard border close. So now we're at the stage where there are suggestions, especially I would take that message very seriously for the over 70s and those with compromised health system. The clear message, stay away from anybody, including children in your families. That is to limit their exposure. They are the most vulnerable group in this one. Now, schools, of course, is a huge issue for people. The idea so far has been that to close schools across the country, the economic impact would actually be so severe it would hamper the efforts of the fight against this virus. So as you heard the Prime Minister and as we've heard health officials talk about, if there are outbreaks at specific schools, at the moment the plan would still be to deal with those in a localised situation. And also to note that also is possible for different communities. So we're hearing today about potential community transmission in Auckland and the Wairarapa, so they have not been confirmed yet, but there is the potential for people in those areas to go into a much more stringent, much more controlled environment, while the rest of New Zealand does not have to. So a range of responses available. It doesn't have to be at that nationwide level.
So what is the Prime Minister saying about potential regional closures or shutdowns as such? Are we ready to go with this tomorrow if we had to?
I would imagine that as soon as there are confirmed transmission cases, because they're still being tested, that is what they would move into, because this is now all about containment. Obviously, with the moving from level 1 to level 2, the risk of community transmission has increased. So the language today was very much about a localised response. But of course, the nationwide response and then moving potentially up those levels would affect the whole country if it needed to. These are just different scenarios and would be very much dependent on what kind of tests and what kind of briefing and updates the Prime Minister and Cabinet Ministers get over the next 24 hours.
Also, we've had Michael Baker on today from Otago University, public health professor, who's saying he doesn't think this is going far enough.
That's right, and we've had, of course, all sorts of different scrutiny and comments on what the government's doing. They say they continue to insist they are making decisions based on the risk. They are making it based on data and evidence. So at that stage, this is where we're at level 2.
Thanks, Jane, and thanks for joining us on this RNZ Checkpoint special. The Prime Minister today has addressed the country and told us to unite against COVID-19. We're going to be back at 5 tonight for a 1-hour special. We'll be speaking to 2 COVID-19 patients, one who's had it and one who has recovered. We'll also do our best to answer your questions. So get emailing us on checkpoint@radionewzealand.co.nz or text us on 2101. Now, that's all we've got time for now, but we'll see you at 5.
RNZ News at 1 o'clock. Good afternoon. I'm Karen McCarthy. The government has launched a new 4-stage alert system to help curb the spread of COVID-19. The Prime Minister says the country is currently at alert level 2, where people should reduce contact with each other. She has asked workplaces to implement plans to reduce person-to-person contact, including getting people to work from home where possible. Ms Ardern also wants everyone to limit all non-essential domestic travel. She says the situation is moving fast and things can change.
For now, I ask that New Zealand does what we do so well. We are a country that is creative, practical, and community-minded. We may not have experienced anything like this in our lifetimes, but we know how to rally and we know how to look after one another. And right now, what could be more important than that?
The Prime Minister also urged elderly New Zealanders and those with compromised immunity or underlying respiratory conditions to stay home. Ms Ardern says the risk of transmission is growing. She says that means people who are over the age of 70 or who are at higher risk of serious illness should avoid the public as much as possible, and for others to give them support.
We need friends, family and neighbours to support our older New Zealanders and people who may be in this group by doing simple things like keeping in contact and dropping off food or other supplies.
Jacinda Ardern says people dropping off supplies must be in good health and have clean hands. The Prime Minister says most schools will remain open while the country is at alert level 2 for COVID-19 unless they're affected by a confirmed case. Jacinda Ardern says that one of her key considerations as a mother is to make sure that children are safe. She says schools will close if there is a case that affects a school. She says sending children home at this stage would not necessarily stop community transmission. The government says it can't rule out the risk of community transmission of the COVID-19 virus in New Zealand, with 2 new cases having no links to overseas travel. The country now has 53 confirmed cases, with 14 new cases confirmed in the past 24 hours. It's the highest number of cases recorded in a single day so far. There are also 4 probable cases. The Director-General of Health, Ashley Bloomfield, says the 14 latest cases are in Wellington, Taranaki, Auckland, Waikato, Taupo, Manawatu and Nelson.
Most of these cases are travel-related, but as yet, in 2 instances, no link to overseas travel has been ascertained, and we continue to investigate. So, at this point, we cannot rule out a risk of community transmission in these cases.
Ashley Bloomfield says the 2 cases not linked to travel are in Auckland and Wairarapa. 3 of the people confirmed in the past 24 hours are in hospital and all are in a stable condition. A microbiologist has applauded the decision to bring in a new 4-stage COVID-19 alert system. Microbiologist Dr. Susie Wiles says the system will be helpful.
I'm absolutely delighted to hear about the alert levels coming in. This is exactly what New Zealand needs because so many people are concerned and they don't know what the right thing is to do. You know, we've been asking people to wash their hands and to limit their contact with others. This now gives us a really clear idea of what to do at different stages.
Dr. Susie Wiles. A business leader says the new COVID-19 alert system will provide a roadmap for struggling businesses. Employers and Manufacturers Association's Brett O'Reilly says the government's business continuity package is providing some relief, but some businesses are very anxious. He says the alert system will offer some businesses a bit of guidance.
This gives everybody a clear sense of the actions that they should take at each point. So yeah, I welcome it, and I think it, along with many of the other initiatives that we're all trying to take, is the best chance that businesses will be able to survive through this disruption.
Brett O'Reilly says if level 4, the top level on the new COVID-19 alert system, is reached, some businesses won't survive. Italy has recorded the highest daily number of deaths from the coronavirus anywhere in the world, 627. Globally, fatalities have exceeded 11,000. The BBC's Paul Adams has more details of the world's response to the pandemic.
With the number of infections recorded around the world now passing 250,000, the global shutdown continues. In Spain, all hotels have been ordered to close by the end of next week. Germany's second most populous state, Bavaria, will be on lockdown from tomorrow. People allowed out only to shop, go to work or visit the doctor. From the cafes and restaurants of Algeria to the beaches of Brazil, everyday life is grinding to a halt. And the fate of this summer's Olympic Games, due to be held in Tokyo, hangs in the balance.
Paul Adams reporting. A New Zealand woman's mother is trapped in Fiji and unable to return home because of the new border restrictions. The mother, a Chinese national, lives here on a parent and grandparent visa, which needs to be renewed every 6 months by way of leaving and re-entering the country. Sophia Song says her mother attempted to do that on Thursday with a day trip to Fiji, along with 35 other Chinese nationals. But their return flight was delayed, meaning they missed the Thursday deadline to re-enter the country.
With the border closing, there's no way they can come back to New Zealand nor they can't fly back to China. There's no flight from Fiji to China. So most of them are with the same situation as my mom.
Sophia Song says the Immigration Department should offer those who missed that flight an exemption. That's the news.
Now, a public health message from the Ministry of Health. The government is advising New Zealanders not to travel overseas. This is the first time this level of advice has been issued and reflects the seriousness of the COVID-19 situation. In addition, new travel restrictions have been placed on visitors coming to New Zealand, with self-isolation still required for citizens and residents returning from overseas. Restrictions on gatherings of more than 100 people indoors have also been announced. For further information on these announcements and for self-isolation advice for those who have travelled, visit covid19.govt.nz.
Music 101 is here in a moment, but first the Met Service long-range weather forecast for all New Zealand to midnight on Wednesday. The situation first, a series of fronts moves across the South Island today.